I'm Dr. Ian MacArthur, board certified plastic surgeon in Ottawa. What do the scars look like after a breast lift? Well, it depends on the breast lift operation that you have. There's only three options. So the first is something called a peri-areolar breast lift. This is the weakest out of the three. I typically only use it with a breast implant. And really, you're only able to raise things about a centimeter. Basically, you're able to change the position of the nipple, not much else. The second type is probably the most common type that I perform. It's called a vertical breast lift. Sometimes it's called a lollipop as well. So it's a scar around the areola and then straight down. And then usually there's some little tiny scar in the crease as well. This is often what I use if I'm putting implants in. However, if someone has a lot of extra skin from weight loss or they want more of a reduction, they're going to get a wise pattern or an anchor pattern incision. So that's basically the vertical scar, the same one as the one I talked about last, but it's going to go a little bit longer. So it's going to go longer in the crease. It just gives us more control over the shape of the breast. It's able to remove more skin. All of these operations, we're saying lift, we're not lifting anything. We're tightening and removing tissue and pushing things up. If you're actually doing a lift, what that implies is you're lifting something up here. When I do this, this would mean I'm putting a scar here. No surgeon would ever do that. Those are your three options. It really comes down to your anatomy, what's going to look the best. We're never trying to add scars when we can avoid it. And so I'm always trying to do the least invasive, smallest scar burden that we can get away with. So if you're interested in breast lift surgery, please contact us. We'd be happy to help.